Okay, so today we're really exploring something that's, well, kind of huge when it comes to addiction and mental health care. Inpatient versus outpatient care. And honestly, it can feel like, picking a path in the dark sometimes. There's a lot of weight to this decision, and there can be a ton of questions.
Totally. And I think we even run into some misconceptions along the way. But what's crucial to remember up front, there's no right answer for everyone. Inpatient, outpatient, these are both valid paths to recovery, whether it's mental health we're talking about or substance use and addiction.
It's more about like the structure of each one and what kind of goals you have, right, Clint?
You got it, Deb. So there's two trails, same mountaintop, just the scenery is going to be different depending on which one you're on.
Okay, so in one of our Sandstone Care articles on the subject, inpatient versus outpatient care, which is right for me, we have this analogy about inpatient care that I think is really good. So imagine you're stuck in a downpour, right? Not just rain, like you can't see your hand in front of your face, right? A downpour. So sometimes you just kind of need to get out of the rain to even think straight. That's almost what inpatient can be, that step back, that safe space to dry off.
It's interesting that you say that because the environment, it's huge. When you're constantly hit with stress, triggers, whatever's got you seeking help in the first place, that's the rain in this case.
Yeah.
It's hard to heal when the rain is pouring down on you. So inpatient, it gives you that separation to just be with your well-being.
Right, like hitting a pause on life's craziness so you can actually deal with what's going on inside. So, before we get too far down this path, let me do a quick breakdown here. So, inpatient versus outpatient, the core differences. So, just everyone's on the same page before we start.
And at Sandstone Care, we're experts in providing multiple levels of care to meet people where they're at. So we do have a pretty good list for this.
Totally. Okay, so with inpatient, basically you're living at the treatment facility, 24/7 care, the whole 9 yards, right?
It's often what's needed early on, especially if someone's detoxing from substances.
So we're talking structured, we're talking immersive. Like imagine your days got group therapy, maybe some one-on-one time with a therapist, even support groups later on. It's a whole thing.
Exactly. And that structure's there for a reason. Those first few days, weeks, however long it is, having medical folks right there, therapy is constantly available. That can be the difference between, frankly, being safe or not being safe, physically and mentally.
And then we have the flip side, outpatient care. This is more about integration, right? So, like taking those therapy skills you learn in treatment and having the opportunity to put them to work in your regular life.
Exactly. You're still doing your therapy sessions, still working the treatment plan, but you live at home and you've got this flexibility for work and school. It's that balance between recovery, but also living your life.
And this is where I think some of the like myths around inpatient, like some people may think you're cut off, isolated, you can't talk to family, all of that. But reading through the Sandstone Care article, that's not actually the case, is it?
Great point. And yeah, big misconception for sure. Inpatient, it's not about isolation. It's about, think of it like structured living. So that talking to a loved one, it can actually help you in recovery, but it can also go the other way, right? Especially early on when things are raw, intense emotions, even a well-meaning chat with someone can throw you off track.
So it's like trying to learn a new dance, but everyone is yelling different steps at you all at once. You need a little space to get your footing.
Exactly. It's not no contact. It's about carefully balancing things out. Connection's important, but so is focused healing.
Right, and that kind of makes sense. So this goes with something else that Sandstone Care mentioned. The limit inpatient programs have, like on your stuff, belongings. I mean, seems strict at first, but they had a good reason, huh?
Oh, absolutely. It's not about being controlling. It's more about minimizing distractions, When you're surrounded by like reminders of your regular life, all those stressors, that can be tough.
Yeah, harder to be present.
Yeah. Hard to really dig into the program, to build those skills, to cope differently if half of your brain is still back home, worrying about something else.
Right, okay, so you create that separation on purpose, and then you go back to your life with the better tools to handle it, right? So, I mean, you wouldn't study for a huge exam in a room full of video games and junk food, right? So you've got to set yourself up for success here.
There you go. And speaking of setting up right, This is where inpatient versus outpatient, the choice really matters. And the article makes a point that hit home for me about picking the wrong level of care. It kind of backfires long term.
Yeah, and they're talking about the cost, right? Because upfront, outpatient may sound cheaper, but if you're not ready for that, it can be a more costly decision in the end.
Exactly. If someone needs that structure, that intensity that inpatient provides, trying to tough it out in outpatient, the risk for relapse, it goes way up. And sadly, relapse often means starting the whole process over. So then you're paying more in the long run, not just emotionally, but also financially.
Like building a house on sand. You might save some time, some money at the beginning, but it ain't gonna last. So knowing all this, how do people even begin to figure out which one's for them? It seems like so much to consider.
It really is, but luckily our article lays out some very clear factors to think about. And one of the biggies is how severe is the condition?
Okay, so like how much is it actually impacting your daily life?
Exactly. If it's at the same point where you can barely function, like intense urges to use, if that's the issue, or even, thoughts of suicide, that level of disruption, that's usually saying, okay, inpatient's probably necessary.
It's a gauge of like how much trouble are you having just getting through your day, basically. So that's one thing, right? So what else should people be factoring in?
Your home environment, that is huge. It really is. It's like imagine trying to recover from, say, a knee surgery, but you live on a trampoline, right? That ain't gonna work. Talk about unsteady. And for some people, their home life, it's a trampoline full of triggers and temptations, things that make it so much harder to heal.
Wow, yeah, that's a powerful way to put it. So, inpatient's almost like providing that solid ground, getting you away from all the stuff early on when it's the hardest.
Got it. And then the other part is personal responsibilities. So think about work, school, all of that. Can you really step away from inpatient treatment? For some folks, it's just not doable. And that's okay. Got to be real about this and what you can manage.
Right, like the real world doesn't stop, unfortunately, but here's what really stood out to me from the article. They made a point of saying, look, this isn't about toughing it out. It's not a willpower thing. Sometimes just admitting you need that higher level of care, sometimes it's the bravest thing, the kindest thing you can actually do for yourself.
Couldn't agree more. It's about your well-being needs, and everyone's recovery has its own path. It's its own timeline, and there's no shame in needing different things at different points.
Absolutely. And whichever route makes sense, inpatient, outpatient, sounds like both places, you're going to have people who know their stuff, who actually want to help you.
Oh, for sure. That's a given. These are professionals who dedicated themselves to this, and you're in good hands either way.
And on that hopeful note, we're going to wrap up this amazing episode. And to you, listeners, if you want to go even deeper on this, check out Sandstone Care's article under our treatment resources page. So until next time, be good to yourselves, and remember, asking for help is not a weakness. It is wisdom.